This is our school sealant programs presentation, presented to you by Riley, Kylie, Nayeli, Carly, and Justine.
What is a sealant? A sealant is a thin composite or plastic material that gets placed in the pits and grooves of the chewing surfaces of your back teeth, called the premolars and molars. Usually, these grooves and pits on the teeth are so narrow and deep that your toothbrush bristle can't get in there and keep them clean. To help prevent these areas from trapping any bacteria or developing cavities, we seal them with sealants to make it much easier for your toothbrush bristles to get in there and keep them clean.
There are many benefits that come along with the application of sealants. The first is prevention. Because the sealants are filling in the pits on the teeth, they help avoid cavities. The second is that it's an easy process. Sealants are very easy to apply, and it is a very quick process. Number 3 is the cost. The cost of sealants are significantly cheaper than the alternative of having to get a filling. Number 4 is that they are safe. They are safe and BPA is not an issue. Number 5 is that they are painless. No painless comes along with sealants, although there might be with fillings. With sealants, there are no drilling or anesthetic. It is just applied directly to the surface of the tooth.
I will explain the steps of sealant placement so you know what your kiddos will be experiencing. The first thing we would do was clean the plaque off of the top of the tooth. Then we will apply a blue jelly called etchant. What etchant does is it breaks down a really thin layer at the top of the tooth so that sealant will hold and stay in place. We will dry the area really well where the sealant is going to be placed. Then we apply the sealant material, making sure that we get all of that material into the grooves and pits and all the little deep spots in the top of the tooth. After that, we will use a curing light or cure the material, which is to harden the material, however the manufacturer describes that needs to be done. After that cures and is hard, then we check the occlusion, which is we'll have your child bite together just to make sure everything occludes and they're able to bite normal again. And then we will just floss their teeth to make sure that there was no material that leaked in between the teeth. One of the most important things to remember when we're applying the sealant is to make sure that we keep everything really good and dry. Any saliva or moisture that gets contaminated into the sealant material will cause the sealant to fail.
In this video, you will see the steps of applying a sealant as well as the proper procedures to take in order to have a long-resistant sealant. How long do sealants last? Sealants can protect the teeth from decay for up to 10 years if they are properly placed. However, they should be checked at every dental visit to ensure that there are no chips or openings for leakage.
Home care with new sealants. Home care with new sealants is the same as your normal home care. The first few days you have your sealants, your bite will feel off, but with normal activities such as talking and eating, your sealants will level out and they will become more normal, so you won't even be able to tell they're in your mouth. To keep the sealants doing what they should, you need to maintain good oral hygiene. This would be to brush twice daily, once in the morning and once at night with a fluoridated toothpaste, and to floss daily. And this will help you ensure good oral hygiene, and it will help you ensure that those sealants will do what they should and keep your teeth from decaying on the tops.
Who can get a sealant? Both children and adults can benefit from getting sealants. The earlier you get them, the better, to help protect your teeth from getting any cavities. Sealants are no substitute for brushing and flossing, but they can keep cavities from forming and even stop early stages of decay from becoming a full-blown cavity. Sealants are very beneficial and have been shown to reduce decay by nearly 80%.
iSmile is a statewide program that helps kids get access to the dental care that they may need. Below, we have provided a link to the iSmile website.
To begin seeing kids.
This is a video by the Knox County Public Health Department showing you a school-based sealant program.
Hopefully we kind of are saving a tooth. I'm a firm believer in the sealants. I think that they are awesome in what they do and provide. It's a great protection.
The most common place for a child to get a cavity is on their chewing surface of their tooth. The pits on the teeth, sometimes the toothbrush just doesn't want to get down to the deepest point, but a dental sealant can help smooth that out to prevent that bacteria from going so deep that it causes cavities.
We have a DVD that kind of shows this little cute cartoon that kind of lightens the mood, lets them kind of relax a little bit. And then usually what we try to over and over say to the kid is that we're here to help you, we're not going to hurt you.
Tilt your head back and look up to the sky, open as big as you can. Perfect. Wow, that's great.
When I have a child that comes in with anxiety, you show them what it is, you let them see it, you let them feel it, you show them how the paint works and everything, and it's not a shot. Be real sympathetic to their fears, and a lot of times they relax, and once they see one tooth done, they're like, oh, okay, that's not so bad.
That was done in no time.
As the health department, our focus is to keep people healthy. For a lot of kids, they don't have a dental home. It's convenient for us to be able to come into the schools and see them and place sealants on their teeth. Dental disease is a huge reason for kids missing school. If we can come in and do sealants on them, it can help prevent them from having, future dental problems. We have everything that you would find at your dental office. We have the chair, we have the instruments, the compressor, the suction, the sterilization. We're a fully OSHA compliant mobile dental office. We send a report home to the parents, and at the bottom of that, it informs the parent if they feel like their child might be eligible for TN care, that they can always, call and find out. If they have a problem, we're always open to see that child.
Thank you, bud. Have a good day, okay?
A lot of times they'll get up and be like, I got sealants and I got a pencil. This is awesome. And then they'll come back the next day, can I do it again? And I'm like, you just did it. You don't need it done again.
iSmile is a statewide program that promotes the importance of oral health and is managed by the Iowa Department of Public Health. iSmile connects individuals with medical and dental providers for a lifetime of wellness. Some of the things that iSmile does within the community is provide dental screenings, applied fluoride and sealants for school-age kids. They can also help with finding funding and setting up transportation to get to your appointments.
In this slide, we have provided the link to find your nearest iSmile coordinator.
iSmile in schools. Sealants can be done at your primary dental office, or if you do not have access to dental care, many iSmile coordinators visit schools all across Iowa. 19 organizations in Iowa, either through county health departments or private nonprofit groups, administer iSmile at schools locally through contacts with Iowa Department of Public Health. Participating schools are selected by the Iowa Department of Public Health, so that means not all schools will qualify for iSmile, but those with the need seen by the Iowa Department of Public Health will qualify for iSmile programs to come to schools in that area.
Benefits of iSmile. iSmile works by informing parents about the benefits of regular dental care. They encourage children to begin dental care at a young age, and they help find dental coverage and dentists accepting Iowa Medicaid and connecting these families to these dentists to receive the dental care their child needs. Having access to iSmile in schools is a very beneficial program for children.